Hi, I'm Dr. Castanet again. Now I'm going to show you a demonstration of treatment using the SpineMed cervical spinal decompression treatment tool. I have Marianne a little higher on the table now. She's secured in the cervical apparatus for the neck. Her neck is cradled in this right here. I've got a strap across the forehead to restrain the forehead. That keeps her head down where it needs to be and the neck where it needs to be for the purposes of treatment. Is that reasonably comfortable, Marianne?
Yeah, it is.
Okay. I have the treatment table on now. This is again the monitor that patients can watch. This graph here has a y-axis there that shows you time, and that's the 5-minute mark. It's going to go for 30 minutes in the way of treatment. The red line right there represents the tension. I have the tension set for 13 pounds for the neck, which is a little aggressive for the first treatment for the neck. That's typically more than I would start with for most female patients, certainly. And it's not yet at the maximum. It takes 3 minutes for it to ramp up to the maximum level. At that point, though, it'll probably be comfortable for Marianne. I made a note earlier in terms of discussing the low back spinal decompression treatment that it's nearly imperceptible when you're actually getting the treatment. That's not true for the neck. The neck is more sensitive to pulling or stretching, and it's always more perceptible in the neck than it is in the low back. So she will feel it, but I trust it'll be comfortable. It's also true that for both treatments, there is a switch that the patients always have possession of, and they can push the red button and at any time stop the treatment. That's happened twice, I think, in 6 years for me, and both times the patient had to use the restroom. So it wasn't because it was uncomfortable. It can be uncomfortable sometimes, although that's not usual. When it is uncomfortable, most patients grin and bear it. They prefer to go ahead and do the treatment and see what the outcome is like later, which is in fact more important. Sometimes when the tissues of the neck or the back are inflamed, any sort of mechanical movement or manipulation of the tissue is uncomfortable, although not excessively so. And that's important insofar as you have to tolerate it during the course of the treatment. But what's more important, and what's generally favorable, is how they feel later that day or the next day as a result of the treatment. And generally, if you move those tissues and they're inflamed and tender and they need to be moved and decompressed, then even if in the short run it's a little bit uncomfortable, it's generally going to benefit them in the longer run, meaning later that day or the next day. That's the typical scenario on the occasions that it is uncomfortable for a patient to actually receive it. But again, it's never generally very uncomfortable. That just doesn't happen, that people stop treatment because it's too uncomfortable. Marianne, we're now at the 3.5-minute mark. Mm-hmm. It's at the maximum tension of 13 pounds now for Marianne. Tell the listener what you're feeling now. How's it feel?
You can feel the stretch. I mean, you can definitely feel the tension on your neck, but it's not uncomfortable. Yeah. But you do feel it.
Do you have a neck problem?
A little bit, yeah. I tend to get a stiff neck.
Yeah. What did you, well, and this is not an example of the kind of patients we treat. We're generally treating nasty, difficult neck and back problems radiating into the shoulder blade, the shoulder, down the arm, disc herniations, things like that. Marianne doesn't really have a problem symptomatically. She's just serving as our model, but she has a minor complaint. People like her typically wouldn't come to me for treatment because most people just sort of live with the minor aches and pains, and that's reasonable. We're accustomed to treating nastier problems. But anyway, you did say before that you actually like the neck treatment.
Oh yeah, I definitely do, yeah.
Even though you don't have a neck problem per se, not a significant one.
Right, just because I can feel it more. And like it's just now it's relaxed a little bit, so you can feel it let the pressure off, and then of course it'll come back up again, so it kind of relaxes and then tenses up. So I like it that you can feel it.
One other thing, I don't want to fail to mention this, that the way the table works is that this middle component of the table right here, this middle component underneath her torso, this is always immobile. It's stationary. What moves is either the lower half of the table in the case of the low back, which separates the low back, or in this case the neck, it's this apparatus moving northward that way and taking her head up that way, her skull and head that way, and that separates and distracts the vertebrae of the neck to take pressure off of the joints, the discs, and the nerves. And those are almost always the pain generators in the neck. So that's how it works, and that's a demonstration. And if we can help you, please give us a call. Thank you.